Hey, good Tuesday afternoon, everyone. We are the Senate Budget and Taxation Committee Subcommittee on Health and Human Services. We're gathered this afternoon for the purposes of budget decisions. As we get started, certainly want to thank our committee staff. Philip and Will have been with us every meeting this session, both via Zoom and in person, and want to acknowledge the hard work of the members, Senator Eckert, Senator Rosapep, Senator Young, Melanie Griffith, and we have had some really phenomenal analysts working with us this session. And so we're going to go through some decisions this afternoon and respond to the recommendations that have been made to us by our phenomenal analysts from Department of Legislative Services. So I think Ms. Pedersen is going to start us off and get us through this process. So let me just thank everyone for their flexibility and accommodating this meeting this afternoon. And I think without any objections, we're ready to get started. Okay.
Thank you, Madam Chair. If I could ask you to turn to page 1 of the decision document, we will start with the Office of the Deaf and Hard of Hearing. DLS recommended to concur with the allowance and the agency concurred.
I'll move to adopt.
We have a motion and a second. Without objection, we'll take that recommendation and concur.
Going to page 2 and then on to page 3 in the Department of Disabilities, DLS recommended to adopt narrative on the Universal Services Trust Fund expenditures. The agency concurred with that recommendation.
Move to adopt.
Second.
Okay. That item will be adopted. And members have any objections, just speak up. Otherwise, I'll take that as a concurrence with the motion. Okay. Kelly?
Moving on to page 4, we have the Executive Department of Boards, Commissions, and Offices. DLS recommended adopting the following narrative of a training outreach data report, and the agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
The second item is another DLS recommended of adopting the following narrative of continuing the surveys for the MBE participation attainment liaison surveys from last year. There is an additional item, a color page item that would modify that DLS recommendation to add an additional question to the survey.
Do we know what that is?
This is page 4 and page 5.
Okay.
Yes, Senator, I think that was during the hearing, we talked about wanting to find out how much time the MBE liaison spend doing that work. It might be a subsequent conversation, but that's the additional language.
Got it. So we'd like to adopt that.
Okay, so
we want to reject the DLS recommendation, that first recommendation, and then adopt this alternate one.
okay, is there a second?
Second.
Okay, so without objection, we'll reject DLS recommendation and adopt the new language. Okay.
And the third item is also on page 5, DLS recommending adopting the following narrative that the Maryland State Commission on Criminal Sentencing Policy conduct a plan for studying racial bias in sentencing in the state.
Move to adopt.
And
The agency
agency concurred.
Yeah, okay, great, thanks. Adopt.
Okay, that's adopted.
Moving to page 6 with the Secretary of State, DLS recommended concurring with the governor's allowance and the agency concurred.
Adopt. All right, move to
Action, very good. And I just want to mention during the Secretary of State's budget, we did hear, and we had a conversation asking them to share with us the promotion of their outreach. And I want to say I have seen them sharing that information and been able to share it with constituents. So wanted to acknowledge that. Thanks.
Moving to page 7 in the Department of Aging, the first DLS recommendation is to adopt language requesting information about the department's spending plan for the information and assistance enhancement funding. The agency disagreed.
I think the agency did submit some of that. So can we reject that?
Okay, so we'll reject the rec. Very good. Okay.
Going to the second DLS recommendation, DLS recommends adopting narrative, requesting data on wait lists and utilization of several programs that received enhancement funding in fiscal 23. The agency concurred.
Move to adopt. It's an important issue we need to stay on top of. Thank you.
Okay.
Then going to page 10, DLS recommended to adopt narrative requesting information on utilization of the Community for Life and the Durable Medical Equipment Reuse Program. The agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
Page 11 for the Maryland Commission on Civil Rights. DLS recommended adopting narrative asking for a report on pending and open cases and investigator staffing. However, there is a color page item which slightly modifies the DLS recommendation and adds a bullet point, including in the recommendation a plan for addressing its backlog of open cases.
That's an important addition. So we could reject the DLS recommendation and then adopt that new language.
Okay, very
Second.
good. That action is adopted. Okay.
Then moving to page 14 and the military department, the DLS recommends concurring with the governor's allowance and the agency concurred.
Move we adopt.
Second.
Okay, that's adopted.
On page 15, we have the recommendation for MIMS. The first item is a DLS recommendation for committee narrative around emergency medical technician staffing shortages and some of the activities they've had there. The agency concurred with this recommendation.
Move to adopt.
Second.
Okay,
And right below that, still on page 15 and continuing to the following page, we do have an additional item for your consideration. This is budget bill language, specifically on the interfacility transportation between hospitals here in the state, both for emergency and non-emergency.
Great. Yeah, second.
okay, so that language is adopted. Okay, and that was the transport, right?
Right. That's a big issue in a number of different fronts. So we need to get
Right,
all
and we
the-
did hear testimony on that during our
Right.
brief. Okay, thank you.
On the next page, on page 17, we have the state archives. DLS recommended concurring with the governor's allowance and the agency concurred.
Move we adopt.
Second.
Okay, that's adopted.
Next for your consideration on page 18, we have the Maryland Health Benefit Exchange. The first item is a notification of state innovation waivers to notify committees when the exchange submits for those, if and when they concurred with this recommendation.
Move to adopt.
Second.
Okay, adopted.
And then below that, we've continued a recommendation for continued reporting on the reinsurance program, both the cost, forecasts, and uses of that. The agency concurred with this recommendation as well.
Adopt.
Okay.
Second.
Adopted.
Thank you.
On page 19 for the State Department of Assessments and Taxation, you'll see that DLS recommended the following narrative, adopting the real property valuation staffing report, and the agency concurred.
Move we adopt.
Second.
Okay, it's adopted.
Then on page 20, you'll see another recommendation, and this is to adopt the following narrative on the homeowners and renters tax credit, and the agency concurred with this as well.
Adopt.
Second.
Okay, done.
On page 21, you'll see the property tax assessment and appeals boards. DLS recommended concurring with the governor's allowance, and the agency concurred. And then there's an additional color page item that was added afterwards. And this is to get some more information on a backlog in one of the counties that PTAB serves, and that would restrict $50,000 from PTAB.
So I would, go ahead, I'm sorry.
No, just a little confused. It says DLS concurred with the governors, but it says reject.
Yes, Senator, basically, if you'll recall, when we had this hearing, there was a deep dive and a significant amount of questions around a particular county that had
So, okay.
that deep backlog, and there were questions about what would be necessary to help resolve and address that. And so this language that is listed here under the recommendation would be to give them some specific request about how they would address that backlog and when and what support is needed from PTAB.
So we'll reject DLS and adopt the alternative.
Yeah.
Okay.
Second.
Yeah. Same.
Great.
Okay,
Thank
so
you.
that action is adopted. We will move, the motion was to reject DLS and adopt this language. So that action has been taken. Thank you.
All right, on page 23 begins recommendations for the Maryland Department of Health, beginning with the administration. The first item here is budget bill language pertaining to staffing levels and vacancies at the health department. This both continues some reporting last year that was unfulfilled, as well as consideration for the facility master plan and how MDH staffing will be aligned with that. MDH did disagree with this recommendation.
I think that's important information to get, and I don't think we got it last year, correct? So
No, you didn't.
we need to continue this. So I would adopt the provision.
Second.
Okay, so that language is adopted.
On page 24, item number 2 is also budget bill language on the Maryland Department of Health. This particularly looks at the placement times for the individuals who are incompetent to stand trial, IST, or not criminally responsible. MDH has had challenges meeting those legislative mandates in recent years, and so this restricts funding pending a report on how they'll be able to meet those. They disagreed with this recommendation as well.
Yeah, I guess move to adopt. I think, again, I know they've had a lot on their plate, but we still need to get this information. We're still hearing about some of these issues. So I would move.
And that language is adopted.
On page 25, we have committee narrative for your consideration, still in the MDH administration. This particularly pertains to patient staff safety. Now that all of the hospital facilities are unified under the administration, DLS recommended unifying how they are reporting patient staff safety measures. The agency ultimately concurred with.
Move to adopt.
Second.
It's adopted.
All right, on the following page, we have the Office of Healthcare Quality, still in the Health Department. The first item is a DLS recommendation to increase the turnover rate to 5%. It came in budgeted at 0. This would represent about $1 million cut, most of that being in general funds. The agency disagreed with this recommendation.
Now reject the DLS recommendations. So we.
Okay, so the recommendation is rejected, so we will not adopt that language. Okay.
And then still on page 26, still with the Office of Healthcare Quality, we have an additional item for your consideration. This is committee narrative around flu vaccinations and the guidance and to the degree to which hospitals are participating in new guidance that the CDC is patients, and having the Office of Healthcare Quality do a survey of those policies.
Okay.
Move we adopt.
Second.
Okay, that is adopted.
On page 27 begins the health professional boards and commissions recommended actions. And the first recommended action is to add language to the special fund appropriation restricting $100,000 from both the Board of Professional Counselors and Therapists and the Board of Pharmacists to have them resolve a repeat audit finding from the previous year. And the agency did not provide a response on this.
Move to adopt.
Second.
Okay, that item's adopted.
Then on page 28, you'll see the second DLS recommended action is to have the Board of Dental Examiners report on their failure to attain performance measures, and the agency concurred.
Move we adopt.
Second.
Okay, that's adopted.
The third item, also on page 28, is to fix repeat audit findings from over 19 of the individual boards, and the agency did not provide a response.
Move to adopt.
Second.
Okay, that's adopted.
The fourth recommended action is on page 29. And this is to get more information on the increase in the licensing and regulatory management system project, which is one of their IT projects. And the agency disagreed.
Move we adopt.
I'm just trying to review it, that's all.
Okay.
Second.
If you recall, Senator, this is in the previous year, the total cost of this project was $2 million. And then in this upcoming fiscal year, they expect it to be 10 million. And we've asked them to explain what that $8 million increase was.
Correct, thank you. Thank
You're
you.
welcome.
So is that a second? Do I hear a second?
Second, yes.
Okay, all right. So there's a motion and a second. That
I'm about
recommendation,
to sneeze, so excuse me.
bless you. Okay, that narrative is adopted.
The fifth item is also on page 29, and this is again related to that audit. It's restricting $100,000 from the Board of Nursing until they resolve the repeat audit finding.
Okay, so this recommendation is language about repeat audit findings on the Board of Nursing. Is there a motion?
Adopt.
Yes.
We can-
Second.
Okay, motion and second, that's adopted.
On page 30, you'll see item number 6, which is asking for narrative for the boards to talk about the cybersecurity impact on the boards, and the agency disagreed with this recommendation.
Move we adopt.
Second.
Okay, that item is adopted.
And then on page 31, this is the last item for the boards for you to consider. This is asking for a report on processing and timely investigations of the Board of Nursing. And it has a couple bullet points for you to read through.
Move we adopt.
Second.
Okay, that narrative is adopted.
All right, moving on to Public Health Services. This begins on page 32. This first DLS recommended action would add language restricting funds pending report on the Office of the Chief Medical Examiner, specifically their accreditation status and efforts to recruit and retain staff. MDH disagreed as they recently submitted a similar report. However, there is an alternative version of this language that starts on page 33. The difference from the DLS recommendation is actually on page 34. And so this would add more information requests on the vacant chief medical examiner position, the backlog of autopsies to be performed, and then any assistance received from FEMA.
So we would reject the initial recommendation by DLS and then adopt the new language, correct? Move to adopt that new language.
Okay, let's second.
33, 34
Second, yeah.
additional items.
Okay, so DLS, that recommendation, we will pass on and adopt the new language.
Right, so then at the bottom of page 35, there's a second DLS recommended action. This is also language that restricts $500,000 pending a report on state public health and local health department vacancies. This report was also requested in last year's JCR, and MDH disagreed with adding the language again to this year's and plans to submit the report that was requested last year.
So can we modify and modify it by restricting just 250,000. Keep the rest of the language in the report.
Okay.
So it would be reject the DLS, but I guess, or just amend it to be 250,000 versus 500. Would that work?
Yep, I see no objection to that modification. I see a second. That action is adopted.
All right, so then item 3 on page 37, this is a recommended narrative that would request a report on higher education programs and loan assistance repayment programs that could support recruitment in the Office of the Chief Medical Examiner. The department disagreed with this narrative, saying that they already implement a fellowship program.
Okay.
That fellowship program cover all of the items we have listed?
I would say this narrative asks for, before the fellowship, you know, higher ed and kind of more training, or not training, but credentialing of medical examiners and other staff before they would get to the fellowship and training stage. So this is asking for different information.
Okay,
So move to adopt.
second.
Okay, that narrative is adopted.
Yeah, so that would give us more information to help understand the shortage and what we need to be doing with recruitment, correct?
Right, especially as, I mean, there is a national shortage of pathologists who could fill medical examiner roles. And so this narrative and the report would be specifically about higher education. It also involves UMB and MHEC. So it is focused on the higher ed piece and basically graduating more forensic pathologists who could take those jobs once they graduate.
But it puts them on high alert that this is needed and they need to be engaged in that process. So that's part of the beauty of that. Thank you.
Thank you, Senator.
And then on page 39, this is items related to the Prevention and Health Promotion Administration. DLS recommended concurring with the allowance. The agency concurred with that.
We adopt.
Second.
Okay, that is, action is adopted.
Right. On page 40, begin actions related to the Behavioral Health Administration. The first item here is a DLS recommendation as it pertains to the ASO and the forgiveness of overpayments. However, since DLS already made this recommendation, we have learned some information, and so I want to direct your attention to page 41, the additional item there. What this does is it clarifies the specific around the overpayments and making sure that forgiveness that occurs does not already have a claim associated with it. Of course, since the hearing, we learned that of the 215 million or so that is outstanding, about 80 million of that has a claim associated with it currently that was denied.
So, colleagues, as you know, this is the item we've spent a lot of time on.
A lot of time.
I'm still not even convinced that this is getting us all the way there, but it is another step closer. And certainly we're in conversations with our committee chair and members of the House that are also, as well as our colleagues in the Senate. But this language is at least closer to, I think, what we have discussed as getting us towards some resolution to this ongoing and very complex issue. So.
Thank you. I got an email on this very thing today. So I would move to reject the DLS recommendation and adopt that new language on that additional page. It's at 41, 42.
Yes.
Okay.
Second.
Okay, so there's a motion and a second on the new language on pages 41 and 42. Without objection, we will take that new language action. Okay.
Excellent. Continuing on to page 42, item number 2 is a DLS recommendation. This is annual language that restricts provider reimbursements to be used within those categories. This is going to be one of 3 that you'll see this afternoon. The agency concurred with this item.
Move we adopt.
Second.
Okay, that is adopted.
Below that, we have DLS recommendation number 3. This is a mistake that was made in the fiscal 2023 allowance in terms of the sources of funds that were being used for the home community-based services rate increase. While the department did concur with this, the governor took care of it for you in the first supplemental.
Okay, so we'd move to reject the DLS recommendation, right?
Correct.
Okay, so that recommendation will not be taken. All right.
Continuing on page 43, item number 4 is a DLS recommendation for committee narrative, particularly around the behavioral health, telebehavioral health availability. The department's been tracking that in rural settings, and DLS recommended that they report on that statewide and not just in the rural settings. The department disagreed with this, noting that really the only data they have access for is the public behavioral health system and the telehealth uses there. And that's certainly consistent and in the spirit of with what DLS initially requested.
Okay.
So do we still need to modify that to specify that the department will provide that information on the public behavioral health system?
Yes, if that's your pleasure.
Yeah, well, yeah, I would move that.
Okay. Is there a second?
Second.
All right, so we will modify. Thank you.
Thank you. And then below that, we have another DLS recommendation. This pertains to the use and prevalence of medication-assisted treatment here in the state, and the availability of that and any barriers to access that treatment. The department did concur with this recommendation in spirit, however, requested the due date be pushed back to December 1st of this year.
Okay, so we're modifying it to December 1st.
Second.
Okay, without objection, December 1.
All right. The next item for your consideration on page 44 is item number 6. Actually, item 6 and 7, these are the continuing 2 parts of the annual language that the department concurs with, keeping those provider reimbursements within those categories and only allowing them to transfer within those budgets.
Move to adopt both of those.
Second.
Okay, those actions language are adopted.
And still on page 44, item number 8, this is another cleanup action that DLS recommended. The governor took care of part of this for you. However, there's still about $65 million in double budgeted funds that DLS would still recommend deleting under this item.
Okay, we modify to delete the double budgeted funds.
Second.
Okay, so that modification is adopted.
Excellent. Moving on to page 45, item numbers 9 and 10. This pertains again to the ASO and your first action here in the budget. But what was presented with the budget was this language was rather vague and around just issues pertaining to the ASO. What DLS recommended is clarifying that language to specify that could be used for provider forgiveness, given that that's what it was issued for. And DLS also included an allowable use of that to be used for provider reimbursements, given some of the adequacy concerns that we have in fiscal 2022, where this funding has been provided. In order to be consistent with some of those actions that you made back at the beginning of this budget, you could specify that the forgiveness is only, again, for those overpayments that we know are true overpayments and not associated with the claim or something that could later be adjudicated or have federal funding attached to it.
That sounds good. Why don't we modify it with that language?
Okay,
Right, Andrew?
Second.
all right, so that modified action is taken.
Excellent. And we have 2 more additional items for your consideration on the Behavioral Health Administration. That begins on page 46. This item here is for the pre-admission screening and resident review program and behavioral health screening that occurs prior to entering into a nursing home here in the state. And this language restrict funding pending a report on what those current federal regulations are and how the Maryland system as it currently exists complies with that.
Okay, move to adopt.
Second.
Okay, that is adopted.
Excellent. And then on page 47, we have a a third color page item for your consideration that continues on to page 48. And what this does is restrict funding pending a report, particularly on 988. As you may recall, during the hearing, we had discussed the increase in perhaps 988 calls once this new federal regulation comes in, as well as other behavioral health crisis response needs that may occur in the state.
And Andrew, is this the first time that we are taking this action or something similar?
No, so last year you all did request a committee narrative on 988. That has also gone unfilled.
I thought so. Okay. Is there a motion?
Move we adopt the additional language.
Second.
Okay, that's adopted.
Thank you.
On page 49, you'll see the recommended actions for the Developmental Disabilities Administration. The first recommended action is to restrict $1 million from DDA to have them submit a report on their continuing transition to the LTSS fee-for-service system. The agency disagreed because they felt that they had not been approached on the subject. And if you recall, this is a very similar recommendation to the one made last year.
Okay. Move to adopt.
Okay. A second. All right, that is adopted.
On page 50 at the bottom, you'll see the second recommendation made by DLS. And this is to restrict all funding that goes to the community services program within DDA to just that purpose and not have budgetary transfers outside of the program. And the agency did not provide a response to this. This was also a recommendation from last year.
Move to adopt.
Second.
All right, that recommendation is adopted.
And then finally on page 51, the third recommended action for DDA. This is relating to that first report on the community services utilization data. If you recall from the testimony from the hearing, DDA told us they would be able to provide this data on the 15th of the month, and we have not yet received it. So this would just give them a specific date to start providing that data. And the agency disagreed again, saying that they had not been approached on the subject.
Move to adopt.
Second.
Okay, that is adopted. Narrative.
Okay,
But
beginning
this
on,
was, excuse me just a minute. I just wanted to clarify that because it was in the budget bill from last year, correct?
This is correct.
Okay.
So last year, they submitted the report on January 13th of this year. And it just told us that they would begin providing us data on the 15th, but didn't specify which 15th of the month they would begin providing the data. And so this is specifically giving them a time and a date that they will start providing it.
Great. Thank you. And
You're
we
very welcome.
adopted that, right? Thank you.
Yes.
right? So then on page 52, this begins the actions related to the Medicaid budget. This first action restricts $1 million pending a report on redeterminations following the COVID public health emergency. The department disagreed as some of this data wouldn't be available. So there is an alternative version of this language that starts on the next page for your consideration. This version removes the piece that MDH couldn't provide and then asks for updates on the national public health emergency if disenrollments haven't begun yet when the each quarterly report is due.
Okay, great. Thank you. So let's reject the GLS recommendation and then adopt that new language on page 53. Right.
Okay,
Second.
all right. New language is adopted.
So then at the bottom of page 54, the second item is also language restricting funds. This is pending a report on home and community-based service expansion funds. The department disagreed as they report similar spending information in quarterly reports required by the U.S. Centers for Medicare and Medicaid or Medicaid and Medicare Services.
Move to reject. Yeah, move to reject that. Okay.
Second.
Okay, that language is rejected. Mhm.
So then we'll jump ahead to page 56. item 3 is similar to the language you've heard in BHA and DDA. This restricts provider reimbursements to that purpose and restricts budgetary transfer.
Move to adopt.
Second.
All right, it's adopted.
And then item 4 is a DLS recommendation for narrative on requesting report on the MCO risk corridor agreements that were put in place as a result of the pandemic, and the department concurred.
Move we adopt.
Second.
Okay, it's adopted.
On the next page, page 57, item 5 is also recommended narrative that would request a report on the community options waiver program, specifically on financial and registry data. The department concurred.
Move to adopt.
Second.
And that's adopted.
And then item 6 on page 58 is also annual language restricting funds under the Maryland Children's Health Program to that purpose, and also limiting budgetary transfer.
Move we adopt.
Second.
It's adopted.
Okay. And then items 7 and 8 on page 58, these are both DLS recommended actions to delete a fiscal 22 deficiency appropriation. So this is federal funding that was allocated for to reflect the enhanced match on home and community-based services. There was a budget amendment that also added funding for the same purpose. So the recommendation is to delete the deficiencies, as these are double budgeted. And the agency disagreed, as they said the amendment was adding funds for a slightly different purpose. It was more for recognizing the federal funds being generated, or the revenues. And then this is the showing the deficiency is showing where the funding is being spent. But DLS would recommend you delete this, as these are double budgeted funds.
Move to adopt the recommendation.
Second.
Okay, so we're moving to adopt and reducing the double budgeted funds.
Right.
Okay, that action is adopted.
Great. And then on page 59, there's one more action for your consideration. This is language that would restrict $250,000 budgeted for administration until MDH provides a report on current rate structures and rate setting studies for Medicaid rates across different provider types. This would apply both to the Behavioral Health Administration and the Developmental Disabilities Administration.
Absolutely.
Move to adopt.
Second.
Okay, that language is adopted.
That concludes the Medicaid portion.
Okay,
On page 61, you have your last items for the Health Department and with the Health Regulatory Commissions. The first item is a DLS recommendation on the Maryland model and our hospital financing model, and how it has interacted and addressed the COVID-19 pandemic. However, beginning just below that and continuing on to the next page is a modification of that. That also includes reporting around the surge capacity that was made available during the pandemic, and any lessons learned from this particular crisis going forward in the hospital model.
Move we reject DLS and adopt the additional narrative.
okay, that action is adopted as described.
The second item on page 62 is a continuation of DLS recommendations. This is a continuation of evaluation for the Maryland Primary Care Program, which the agency largely agreed with.
Move to adopt.
Second.
Okay, that narrative is adopted.
Moving to the Department of Human Services on page 64 and the administration budget unit. The first DLS recommendation is to adopt annual language restricting funding for the Maryland Legal Services Program to that purpose. The department concurred.
Move we adopt.
Second.
Adopted.
The second DLS recommendation is to adopt narrative requesting a department-wide recruitment plan. The agency concurred.
Move to adopt.
Second.
Okay, adopted.
starting on page 65 is the third DLS recommendation to adopt narrative requesting a full catalog of the available data reports that the new MD Think system will be able to provide when that system is finished at the end of fiscal 2022 and will be in maintenance and operations in fiscal 2023. The agency concurred.
Move we adopt.
Second.
Thank you. Adopted.
The recommendations for the Social Services Administration within DHS begin on page 67. The first recommendation is to restrict funding based on repeat audit findings until OLA issues a report.
Move to adopt.
Second.
All right, adopted.
The second recommendation on page 68 is committee narrative asking for data on hospital stays for youth and out-of-home placement.
Move to adopt.
Second.
Adopted.
The third recommendation on page 69 is committee narrative asking for a report on status of Family First Prevention Services Act. Agency concurred.
Move to adopt.
Second.
Okay, adopted.
The fourth recommendation on page 70 is committee narrative asking for a report on a new rate structure for providers within the foster care maintenance payments program. The agency concurred.
Move we adopt.
Second.
Adopted.
The fifth recommendation also on that page is language restricting general funds in the foster care maintenance payments program to only be used for that purpose. The agency concurred.
Move to adopt.
And on the next page, 71, recommendation number 6 similarly is language restricting funds in the child welfare program to that purpose.
Move we adopt.
Second.
Adopted.
Recommendation number 7 on the bottom of that page is narrative requesting child welfare caseload data. However, there is a color page on this. The color page is on page 73 and on to page 74. The same language, only there's a modification on the bottom of page 74. The bold item, this is adding language, continuing to ask DHS for an update on a workload study related to the caseload to staffing ratios and updating those.
That's been an ongoing discussion item. So why don't I would move to reject the initial DLS recommendation and adopt the new language.
Okay, without objection, the new language is adopted. New recommendation. Yep.
And recommendation 8 on page 75, this is asking for committee narrative on data on the impacts of economic instability on removals into foster care related to the pandemic and other impacts on cases of child maltreatment going unreported during the pandemic. The agency concurred.
Second.
Okay, adopted.
Going to page 77 in the Child Support Administration, DLS recommends to adopt narrative requesting a report on state enforcement measures. The agency concurred.
Move to adopt.
Second.
That's adopted.
Then going to page 78, and it continues on to page 79, DLS recommended to adopt narrative on child support performance measures. The agency concurred.
Move to adopt.
Second.
That's adopted.
Turning to page 80, these are actions related to the Family Investment Administration. The first recommendation is adopting narrative related to application processing times, denial rates, and case closures. The agency concurred.
Move to adopt.
Second.
That's adopted.
On page 81, beginning on page 81 and continuing on to the next page is the second recommendation, which is to adopt narrative requesting information on the children served in the summer SNAP program. You may recall that the budget includes a significant increase in funding for this program. The agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
Beginning on page 82 and then continuing on to the next page is the third recommendation, which is committee narrative that would request spending on the pandemic EBT program. The agency concurred.
Adopt.
Second.
Okay, that's adopted.
Beginning on page 83 and continuing on to page 84 is the fourth recommended action, which is adopting narrative on employment incentive benefit programs. So this is both the ongoing transitional benefit for those leaving TCA and some job retention bonuses that they're intending to fund with some stimulus funding. The agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
And there is one additional item related to the Family Investment Administration. It begins on page 84 and continues on to page 85. So you'll recall in the hearing that there was some discussion related to the plan changes in the educational and experience requirements for family investment specialists. So this narrative asks for information about those changes, when they would begin, the number of positions impacted, how they would accommodate people coming in with different education experience. It also asks for impacts on the current employees and a comparison of qualifications in other states.
Move to adopt.
Second.
That's adopted.
And that's all for family investment.
On page 86, the recommendations for the Office of Home Energy Programs within DHS. The first recommendation is annual committee narrative requesting data on denial rates and application processing times for energy assistance benefits. The agency concurred.
Move to adopt.
And
Second.
that narrative is adopted.
Right, on the next page, page 87, the second recommendation is adopting committee narrative on DHS's plans to implement categorical eligibility for energy assistance benefit applications. The agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
And on page 88, the third recommendation is adopting committee narrative, asking for more information on the federal low-income household water assistance program and its implementation in Maryland. The agency concurred.
Move to adopt.
Second.
Okay, that's adopted.
And last, you have the Department of Housing and Community Development on page 89. There's one DLS recommendation, which was to make funding in fiscal 2023 for the Project Restore program contingent on legislation establishing the program and statute. The agency disagreed with this recommendation.
Let's reject that one.
Second.
Reject the DLS recommendation. So
That recommended action is
leave the money. Leave the money.
okay.
It's a good program. So
Philip, that looks like we've covered all the actions. Was there anything else that we had before the subcommittee to take up today?
I believe that's everything. Grace, was there anything else?
That'll do it.
All right. Well, let me again thank you, Senators Eckerd, Young, Rosa Pep, for your work this session on the budget. Our fantastic analyst, and Philip, gosh, thank you all so much for just keeping everything together and responding to our questions and all of that. We just appreciate all the work everyone's put in. And with that, colleagues, it looks like this budget decision process, do we need to adopt the full report together, Philip, or are we okay since we adopted each of them?
I don't think you need to, but if you want to go ahead and just do the whole thing as a package to,
Okay.
tie it all up.
So I would move to adopt all the recommendations in the package that we reviewed today.
Second.
Okay, I have a motion and a second to confirm the actions that we have taken today in terms of accepting, rejecting, adopting, modifying. So without objection, that motion carries, and the decisions that we have put forth today will be forwarded to the full Budget and Tax Committee for consideration. Okay.
Okay.
Thank you all so very much, and this meeting is adjourned.
Feel better.
Thank you. I'm fine.
Thank you. Yeah. Sorry.
Thanks.